we're live.
Good afternoon, everybody. I appreciate y'all coming to the press conference. We're going to get this started in 5 minutes. 5 minutes.
Did you get that?
Anybody in the booth? Wrong. There.
All right, thanks. Yeah, I just tried to do a slow zoom for the 80 shot, but I just checked it out.
All right, and we're about 1 minute out.
They say 1 minute out.
Remember Russell Bridge, 1 minute out. Get ready.
All right, good afternoon, everybody. John Ward, coming from the Emergency Operations Center, where Unified Command is established for the response to COVID-19. Kind of just a real quick update of where we're at on numbers, and then Heather will discuss more as far as the ongoing procedures of the health department. So currently we're at 103 cases and 7 deaths. I do want to talk that we're going to change up our press conference moving forward. We're going to now do these on Wednesdays at 1 p.m. We're going to go to once a week, and then if anything significant changes during that time, we can adjust fire and have an unannounced one. But our scheduled press conferences are going to move to once a week on Wednesday at 1 p.m. I want to say we're on day 29 of this response, and as far as the unified and partnerships, and I'm always going to throw that out there between the BCC, the Department of Health, the Fire Department, the Sheriff's Office, the Clay County School District, the municipalities, the hospitals, and our utilities are in constant communication and partnership as we're responding in the community here in Clay County. I truly want to thank the Department of Health, the service workers, the truck drivers, the first responders, and their family who are home managing through this event. This really takes a large group of people to do this, and a support structure from their families that are at home learning the new norms. So I do want to go back, and I appreciate the folks that kind of called me out on it earlier in the week. I want to go back and retract the statement that I said at the last press conference. I've been utilizing the 6 to 8 weeks, not realizing, losing track of time, that we're already 4 weeks into this fight. So what I really want people to concentrate on, though, is that we're looking at the peak of this potentially being the week of April 21st. Okay, but what I want to be clear about is this is not going to be a light switch. When we reach the peak of this, we're going to be many weeks on the backside of this. So there's no exact time frame like a hurricane to say it's going to be passed in 6 days or anything like that. This is all based off of models. But like I say, we're looking at the peak of it being on 21 April during that week. But then we're going to have a recovery period on the backside. The modeling, as we've talked about flattening the curve. Clay County citizens, what you guys are doing are helping. We are flattening the curve. The unfortunate thing in this is by flattening the curve, it's making it last longer. We're still going to have the same amount of cases, but what we're not doing is we're not overwhelming our healthcare systems, our hospitals, our ventilators, those type things. So it's enabled us to manage what we've got in theater within the county. I do want to take time, and I'm going to go off script for a bit, and my health officer and my family and my PIO is probably going to be cringing here in just a minute. I do want to go off script for just a minute and kind of take this personal and let you know that we're learning the new normal and the CDC guidelines just like you are as we go. I'll pick on Chris to my left. Does Chris, the sign language interpreter, generally stand within 6 feet of me? Yes. Do I sometimes touch the podium after somebody else does? Yes. Okay. These are new normals that we're learning, and we're feeling the struggles just like you are. Okay. I have 2 high school seniors that don't know what their path is, to the end of the school year. One of them thinks, just give me the piece of paper, and he's happy. I've got another one that's heartbroken, not knowing what they're going to do. As far as, our families are seeing layoffs. We have administrators and teachers that are learning the new distant learning in this and dealing with those struggles. And I will say Clay County's done a phenomenal job in this as far as how they've become. And then also I've had, and she's going to kill me, but I've had a family member that had cancer surgery this past week. So we're all dealing with these same struggles because we can't be around them, we can't see them. Not looking for that for sympathy by no means, but what I want you to understand is everybody in this EOC, everybody in this response from the Department of Health and everybody are dealing with these same struggles that we are learning this new norm. Okay, one thing I do want to discuss is we're coming up into a memorialized holiday weekend. We're coming up on Easter, Good Friday and Easter, which normally brings large crowds, large family gatherings, and church services. I really want to caution us. We're hearing some of our radio station and media partners that are saying, they're seeing the decline. Please do not be complacent. What we do this weekend could have impacts on this peak that we're talking about the week of April 21st. We have still got to physically distance. We've got to keep the groups down and controlled as we're moving forward. One thing that was mentioned about the courthouse is we're starting to see large lines and crowds gathering at the courthouse for services. We'd like to ask, phone ahead before you're venturing out. Speak with them on when would be the best time to do this. Again, it's what we're doing is controlling those large groups, and the physical distancing in this is what's going to prevent this from spreading in our communities. And parents, please speak to your children. We're seeing a lot of groups gathering on street corners or whatever it may be. We don't want to have to keep patrolling these. We want parents to be able to talk to their kids and let them know where they're going in this, and let them know that they can be asymptomatic carriers and then spread this to our more vulnerable populations, which is going to cause a surge in our numbers as we move forward. I want to talk a little bit about as we come into the holiday weekend, our parks, our green spaces are going to continually be open. I encourage you to get out, see our beautiful parks that we have, and then also the boat ramps. The boat ramps and waterways will be open. Again, encouraging you to physical distance and stay away from the large crowds. Our Sheriff's Office partners are patrolling around the boat ramps, and then our FWC partners are working the waterways and patrolling and making sure that our boats are staying within or outside of that 50 feet range from each other. I want to talk a little bit about our human services missions that we've got going on. This has become a large lift as far as making sure all our food banks have food. To date, our food numbers, our food banks last week fed 8,980 people. The schools fed 6,567 meals. The senior meals from the senior centers fed 1,548. for a total of 17,095 individual meals that were handed out to citizens within our community. And I want to say that we're seeing this continually rise on a weekly basis, and we're prepared to support it. Our food commodities are supplying food banks to our 6 primary food banks, and we're working with them regularly to ensure they have food that can be distributed out to our communities. There should not be a citizen in Clay County that does not have food or does not have the support they have. If you have a need, please call 1-877-252-9362. That's what we have this structure in place for, is to ensure all our citizens are being taken care of. Same as we have volunteers that are vetted volunteers and screened volunteers that are doing food delivery through the food banks, and also helping if anyone needs assistance getting medications or services along those lines because they're too concerned about getting out into the public. We have a team set up in place that can manage this for you. And if you would like to volunteer, we do have a volunteers reception area, and again, they're vetting and training them to make sure as we're out doing this that we're not going to be cross-contaminating anybody moving forward. And so if you have a program or anything you'd like to volunteer with, please call our call center, 877-252-9362, and that is Monday through Friday, 8 to 5. And then just the one last thing that I want to say is please make sure we're seeing a little bit better on the rumors and stuff that are out there as far as controlling the messaging. Our website, alert.claycountygov.com, is where you can go and see all the CDC information, Department of Health information, and local protective actions that are ongoing. Clay County, thank you so much. And again, as we approach the holiday weekend, please control your groups and please control your physical distancing. I'm now going to turn it over to Ms. Heather Huffman with the Florida Department of Health.
Thank you, John. So I have a few items to go over with you today. As John stated, we're at 103 cases. We have had 7 deaths. And as we are in Holy Week, I think it's important that we take a moment to really recognize and mourn with those families for those 7 individuals. We have had over 1,600 tests done totally, with a negative test of 1,525. Again, our main testing site is the regional testing site at TIAA Bank. That is a regional asset. It is not bound by Duval County alone. If you're Clay County, you can go there. Again, that is for any age group with signs and symptoms. You don't have to have a fever, and you have to have your own PIN and ID with you. And then they will give you the information on how to get those test results. The Florida Department of Health has put out a new COVID-19 Community Action Survey. We will encourage you to take that. That's at www.strongerthanc19.com. It's about 5 or 6 simple questions, and we're just trying to do a community survey to be able to better do action planning. It is National Public Health Week, and as the Public Health Officer for Clay County, I would be remiss without thanking my staff that are incredibly dedicated, professionals that have been working long hours, tireless hours to do contact tracing and interviews for all of those that have become positive. Thousands and thousands of interviews have they been doing, and they have been working 7 days a week since the onset of this. I believe John said that we're at day 29. So I want to thank them and their dedication to not only to the agency, but also to the residents of Clay County. And then lastly, the CDC has recommended simple cloth face coverings, again, that cover your nose and mouth when you're out in public. It's a twofold approach. If I wear that covering, I will not pass it if I have it. And then if you're wearing it, you don't pass something to me. Again, N95 mask and surgical mask should be left to healthcare professionals that are working in the front lines. At this point, I will now turn it over to Howard Wanamaker, the county manager.
Okay. Good afternoon, ladies and gentlemen. John, Heather, thank you for your latest updates. We continue to work with federal, state, and local leadership in our response to this COVID-19 pandemic. Also, thank you to our first responders, doctors, nurses, and healthcare staff that are providing critical medical care to those infected. I want to take a moment to wish everyone a healthy and happy Easter and Passover. I know it is difficult during this time to remain away from loved ones. However, it is essential to remain at home and make sure that you stay apart from others. Unless you're fulfilling essential services, or essential activities. Now, through Microsoft Teams, a virtual Board of County Commissioners meeting will be held on Tuesday, 14 April at 4 p.m. The meeting will be broadcast on Comcast Channel 260, our website, and Facebook, and more information can be found at claycountygov.com. Let's all continue to work together to stop the spread of this virus. Thank you all, and now I'll open for questions. Yes, ma'am.
Mine may be more specifically for the health department.
Okay.
Is that okay?
Yes, ma'am.
Thank you so much. How many of the 7 deaths were at nursing homes?
We don't usually divulge that that's our home address, so we don't divulge that information, but we have had 7 individuals that have passed away, and we want to mourn with them and their families. But we typically do not divulge home addresses, and their ALFs in nursing homes are considered their home and their residence.
Understood. What is the plan for Clay County when it comes to the long-term facilities? As health department, they reported the 16 cases in residents or staff in long-term care facilities here.
So we continue to work with ACA, the Agency for Healthcare Administration. They're the agency that licenses and inspects those facilities. We continue to work with them and do joint assessments if we have any staff or residents that become positive out of those facilities. We look at their infection control practices, how they're donning and doffing PPE, how they're screening and assessing their staff coming into the facility, and then also just doing those contact tracings with those individuals within the facilities that become positive.
And we got a statement from a nursing home in Clay County saying that they're testing everyone. And so what is the initial response? Is that something that all nursing homes in this county should be doing? Because
no, not per se. I think some of the nursing homes, the corporations, and the individual owners of those have made that choice, and we would, again, approve that kind of approach to kind of know where you're at. The problem with testing is the test is only valid based on the timing that you took the swab. If it takes a week to get those results back, you could be exposed during that time frame. And so the fear that I have with testing everyone that are asymptomatic is that they get a negative and they have a false sense of security because you tested on, say, 4/1, but then you get the result on 4/8. What happened during that time frame? And you truly could have been exposed during that time frame.
okay, and with those numbers from the health department, the 16 of staff and residents in long-term facilities, do we know if there may be a strike team that could be coming in from the health department to these nursing facilities, similar to what they did at Duval?
So we did have one of those strike teams come into one of our facilities. They came in along with our infection control team and our epidemiology staff. We had already done our assessment. We did go back with them. We can request that assistance, but they didn't ask anything different than what our normal epidemiology staff would have done. Most of them are in really, really good shape. For the few that we have been in to do assessments, along with ACA, who does these inspections and assessments on a regular routine basis with these facilities.
And when were they here?
It's been several weeks ago.
It's been several weeks. Okay, so with the increase, could we see them come back?
Possibly. I mean, I don't think that's ever off the table, depending on, if we had considered an outbreak versus a single case. We want to look at those and then request that assistance as needed.
Understood. How long did they stay?
I think it depends on the facility when they usually come in. I think it's going to depend on how many cases you have, what kind of infection control practices that you find to be out of the standard range. And so I think it depends on what is happening at that facility and how many cases you're going to have.
Understood. And so that's been the process from now, kind of assessing, and the county is staying in close contact with these nursing facilities.
Oh, absolutely. We have twice a week calls with all the healthcare facilities. We continue to go over the guidance that's provided by the CDC. We continue to message the information that we're seeing about PPE shortages, also about information about when to call. If you have somebody that's been transported, we provide that information along with answering questions on those calls, but anytime, and giving them our contact information so that they can reach out to us if they have any questions or concerns.
And just for clarification, you said that they went to one facility, the strike team went to one facility?
The strike team that was demobilized out of Duval did go to one of our facilities, yes.
Understood. Okay, and then just for that number, again, that's 7, there's no, not at any nursing homes?
We don't discuss where their addresses are, and individuals that live in nursing homes or ALF, that is their home residence, and so we would not provide that information.
Understood.
Perfect.
Any other questions? hearing any, then we'll be done for the day. Thank you so much for attending.